Hi, I'm Dr. Sarah Hodges. I'm one of the ear, nose, and throat doctors here at North Carolina Eye, Ear, Nose, and Throat, and I'm going to talk a little bit about acid reflux today. Acid reflux is one of the issues that we frequently see contributing to problems with the voice and the throat in our practice. There are really two kinds of acid reflux. People tend to be more familiar with gastroesophageal reflux, or GERD, which causes heartburn and upset stomach. The other kind of acid reflux, which we more commonly see in the ear, nose, and throat world, is called laryngopharyngeal reflux, or LPR, which means that the acid is coming all the way up from your stomach into your throat and actually affecting the larynx, or the voice box, and the pharynx, the throat. And the symptoms of that include hoarseness, throat clearing, cough, sometimes sore throat, or a sensation of mucus or phlegm, or even a lump that's stuck in your throat and you can't get out. Believe it or not, there are a lot of people who suffer from the throat symptoms without ever having the GERD symptoms. We think this is because it takes a lot more acid to irritate the esophagus than it does to irritate the very tender lining of the vocal cords in the upper throat. The treatment, however, for GERD and LPR is actually very similar. We certainly recommend dietary changes, things like limiting caffeine, acidic foods such as tomato sauce or orange juice, reducing intake of carbonated drinks. Sometimes chocolate or mint can be triggers for some people. So dietary changes are very important. There are also some lifestyle things that can be helpful, things like avoiding eating for about 2 hours before you lay down for bed, things like avoiding wearing tight-fitting clothing around the waist, and elevating the head of your bed can actually be very helpful for some people who have more symptoms at night. For most of my patients, I do initially recommend some type of antacid treatment, but if they're doing well in a few months, I often encourage them to continue their dietary modifications and lifestyle changes, and we're able to get them off of their medication. If you do have any further questions about acid reflux or about problems that you're having with your throat, we encourage you to reach out to us for an appointment at 919-595-2000. Thanks for listening today.